Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Reena Barai about the Pharmacy First scheme and her experiences of the first few weeks of operation. So, please could you start by introducing yourself and telling us a little about your current role?
My name is Reena Barai. I'm a community pharmacist and owner of a family business that we've had since 1979. It's called SG Barai Pharmacy in Sutton and Surrey. I started my career as a hospital pharmacist 25 years ago and then took over my family business 20 years ago, which is a community pharmacy. And I work here 6 days a week, running the pharmacy, but also, as well as that, I tend to do other roles just because I tend to like different things. So I am a co-founder and co-host of the Female Pharmacy Leaders Network. I was the co-chair of an integrated neighbourhood team. I just stepped down from that role last week. And previously, I've been a CPP tutor. I've worked in primary care and I've worked as a GP practice pharmacist. And I've been a board member of the National Pharmacy Association and a committee member of what was PSNC, now CPE, Community Pharmacy England.
Can you tell us in a nutshell, what is the Pharmacy First scheme?
So the Pharmacy First scheme encompasses several aspects. One is the urgent emergency supply of medication. So patients ring 111 over the weekend or out of hours and they've run out of medication. Community pharmacies can offer that. There is a GP element of it where patients can be referred to us for either minor illness or these new clinical pathways that form part of the Pharmacy First service. And the kind of the new thing and the thing that everyone's talking about are these 7 clinical pathways for 7 conditions where patients can either be referred to us for from their GP or they can walk in and we can assess them to see if they're suitable for the service.
Mm-hmm. And why was it needed? What is it intended to achieve?
I think for many years, patients have been coming to Pharmacy First. I think the NHS has been encouraging patients to come to Pharmacy First for minor illnesses and minor conditions, but there was a limit to what we could do and what we could supply to treat these patients. And I think through frustration from community pharmacy, obviously, because we see these patients, we think, actually, you know what, I'm a prescriber, or actually, if I had a patient group directive, I could maybe supply something to this patient and actually help to complete that episode of care. And what was actually happening is we were seeing some patients sometimes able to offer some self-care advice, sometimes able to offer something they could buy over the counter to help relieve their symptoms, but sometimes having to refer them back to the general practice to see somebody to get something prescribed. And so the Pharmacy First service was born through all the problems we've had post-COVID with access to general practice and primary care in particular, trying to help reduce the workload in primary care so that general practice only sees the patients that it really needs to see. And actually patients with simple minor conditions or common conditions that are included in the Pharmacy First 7 clinical pathways can actually be seen by a community pharmacist, sometimes closer to home, no appointment necessary, and it's more convenient to a patient as well.
Mm-hmm. Now, you mentioned patient group directions, PGDs. What are those and how do they differ from independent prescribing?
So PGDs are legislation that allow the safe supply of a prescription-only medication by certain healthcare professionals. And within all PGDs, you've got inclusion criteria, exclusion criterion. You know, pharmacists, we love a little tick box and we like to ask all the right questions and follow the rules. So PGDs feel very safe for community pharmacists in particular. But obviously, many of us have independent prescribing qualifications as well, which means we're able to independently prescribe within a scope of practice that we feel comfortable to prescribe in. And I think PGDs are a great stepping stone towards what I'd love to see in community pharmacy is that with every community pharmacy, there is an independent prescriber in every pharmacy, being able to prescribe, having that scope of practice to support patients to a different level than they've ever been able to support them to, and having integrated IT across the system so that when we're prescribing, everybody knows what we're doing and we're doing things safely. And that to me is the ultimate goal. And I think that's why Pharmacy First and the clinical pathways are really exciting. We've had PGDs before with vaccines and things like that, but this is the first time we're really getting them at a nationals level for antibiotics and products like that. So I really hope the sector embraces it. I think I'd love to see pharmacy technicians being able to use patient group directions in the future as well. And definitely that would be a really interesting move for our sector to improve our skill mix and our ability to support patients with our kind of team that we have in our pharmacies.
And now I'd like to explore how you got started with Pharmacy First services. The launch date was the beginning of February this year. So how did you prepare, both you and your team?
So the preparation for Pharmacy First has been quite intense. We knew about it sort of before Christmas, but Christmas is like the worst time to introduce any new service or think about any new service. So we decided as a team to park it till January. And then we spent the whole of January talking through the service, looking at the protocols, looking at the clinical pathways, understanding the PGDs, and thinking to ourselves, how do we operationalize this in our pharmacy? And what are the various things we need to do to be ready for launch day? And we decided some of the key things were training, because we all felt that there were some skill gaps in our knowledge, and we wanted to make sure that we were able to safely look inside somebody's ear, for example, and feel confident at what we're looking at and being able to diagnose so that we can then prescribe using the PGD. We wanted to make sure that the day job was under control so that we could introduce this service, because the one thing about Pharmacy First was that we didn't know how busy we'd be. We didn't know whether we're going to have a queue out the door on the first day or whether it's going to be drip, drip, drip. And we have realized there has been drip, 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 which has been manageable. But because we didn't know, we had to kind of plan for potential queues at the door, which we may get to in the future. So for us, it was about the knowledge gaps and making sure we filled those, and then the operationalizing it and making sure that the team understood how we offer this service. And then the third element was the marketing. So talking to our GP colleagues, talking to our patients about this new service, and making sure that they're aware of the ins and outs and the kind of how the service works and how people can be referred or how they can walk in to see us.